Morning.
Can we kick off by... We had the Manifesto launch yesterday, and we've been told all the way through this is fully costed. Everything is fully costed. Only after reading it, the Institute for Fiscal Studies have said today that you talk of delivering actual change, but your manifesto offers no indication that there is a plan for where this money will come from.
Oh, I'm sure everyone's there with their manifestos over their cornflakes. Page 127, we spell out how we're raising money and where we're investing it. And there's an underlying argument as well, and an honesty that we have shown for some time now, which is the country's finances are in a terrible state. So the promises that are in our manifesto are promises we can keep and the country can afford. But there will be lots of things that people wanted us to do that are not in our manifesto because we know the money isn't there and we've got to get our economy back to growth. And that's Labour's central economic argument. We know that people are already paying through the nose in higher taxes because we've got a low growth economy, we've got a higher tax economy. And because people are struggling, we're not going to put up income tax, national insurance or VAT. We know we can't tax and spend our way out of this crisis. We're going to go for growth with a serious plan of economic stability, a serious industrial strategy, investment and economic reform. And if the economy had grown under this government at the same rate it grew under the last Labour government, there'd be tens of billions of pounds available to either put back in people's pockets or to invest in our services without having to increase taxes. So we're paying a very high price for the economic failure of the past. We need to get Britain back to growth, and that's Labour's plan.
How are you going to promote growth, though? Because Penny Mordaunt last night pointing to a £38.5 billion black hole in Labour's manifesto, and in the Mail and the Express today, both accusing Labour of an £8.5 billion tax trap in this manifesto.
Two things. Firstly, I think Penny's got some brass neck, actually, given that her manifesto earlier this week contains tens of billions of pounds of unfunded tax and spending decisions. That's tens of billions of pounds worth of borrowing. We've seen this movie before. This is Liz Truss's mini budget on steroids. It's an even bigger sum than she was proposing. That would see the economy tank, interest rates rise and people paying through the nose again. We don't want to give the matches back to the arsonists on that front. Secondly, in terms of the criticism we've had from the Mail and the Express today, we have said for some time now that there are good things that need to be done, like cutting NHS waiting lists or putting neighbourhood police back on our streets or closing the vacancies in our schools. That means kids are being taught subjects like maths without a qualified teacher. And to fund those things, we're making some fairer choices. We're going to clamp down on tax avoidance, close the remaining non-dom loopholes, a real windfall tax on big oil and gas giants. So we have raised some money through fairer choices. What we're not going to do is put up income tax, national insurance or VAT, because we know that working people have been the first and last resort of the Tories, and we're not going to make that mistake because we know that people genuinely can't afford it right now.
Yeah, but the problem is, and we've heard it from Keir Starmer a lot, haven't we, over the last few days, no increase on taxes for working people. Well, I mean, there's a caveat in there because it doesn't answer the question that has been asked about council tax. It doesn't ask about wealth taxes and capital gains tax. It doesn't answer questions about the tax on pensions. Now, admittedly, to be totally fair to you, no one can actually expect you to outline exactly what you would do over a 5-year parliamentary term. However, some honesty, some transparency to say, well, these are things we are going to have to consider or may consider over the next few years. Well, that would be being honest with us, wouldn't it?
The honesty is in our manifesto in terms of how we're raising money to invest in public services and where the money is going. We've spelled that out very clearly. And people can judge Rachel Reeves on her record now as Shadow Chancellor. She has argued consistently that the tax burden in this country is too high. When we've had newspapers like The Sun running very effective campaigns on fuel duty, for example, Rachel Reeves has supported them because she knows that people are feeling the pinch at the pumps. I'm a motorist. She's a motorist. We know that. We feel it ourselves. So I think when it comes to the argument that Rachel Reeves is making with Keir Starmer, what they're saying is, look, we can't tax and spend our way out of this crisis as a country. We've got to get back to growth. That means having a serious industrial strategy. It means investing in Britain's energy infrastructure and unlocking private sector investment alongside public sector investment, delivering the planning reform that we need so that we can get the new homes our country needs, the new energy infrastructure, the new lab space for our life sciences and medtech sectors. And if I'm the health secretary and I'm able to deliver those 40,000 extra appointments every week and double the number of diagnostic scanners and 8,500 extra mental health staff to cut the more than 1 million people waiting for mental health treatment, not only are we going to be able to get people back to health, in lots of those cases, that means people back to work. So we've currently got 3 million people who are both off sick and off work in our country. Not their fault, they can't get the treatment. But if we get people off waiting lists, not only will we be getting them back to health, we'll also be getting them back to work. That will help drive economic growth.
How are you going to add 40,000 more appointments every single week with the same exhausted, burnt out workforce that has been on strike for over a year, if we're talking about junior doctors?
The good news is that we're taking an approach which is tried and tested and proven at a small number of hospitals, including the hospital I can see out of my office window in Westminster, Guy's and St Thomas's, where by paying staff to do clinics, in their case on a Saturday, they've been able to do as many procedures in one day as they would normally do in an entire week. And we've put aside £1 billion directly into the pockets of NHS staff to fund that extra capacity. No one's going to be forced to do it. But what we've seen in the hospitals where this is working is people do want to do it, and they're proud of the difference they're making on cutting waiting lists. So I'm confident we'll be able to deliver that and deliver that at pace. We're also going to double the number of diagnostic scanners because about 1.6 million people are waiting for diagnostic tests and scans. So if we can get people diagnosed faster, we can treat them faster, better for them, also less expensive for the taxpayer. And also there will be a lot of people waiting anxiously for diagnostic tests and scans who will ultimately receive some good news, some reassuring news. And we want to give people that reassurance sooner rather than later, because often, and I know this as a cancer survivor myself, when you're waiting for a scan, when you're waiting for your scan results, that is a hugely anxious period. So the sooner we can get people diagnosed, we can either give them the reassurance they're all right and to get on with things, burden-free, stress-free, or we can get them onto treatment pathways much sooner too.
Yeah, I mean, you'll have seen one of the first questions last night from the audience was about the NHS and what needs to be done with the NHS. 7.57 million on the waiting list now, and you're talking about these things which are more than tinkering round the edges. But my question to you would be, have we reached a point, and are you a party who could do it in terms of radical change to the NHS? Because isn't that what this needs now?
I think we're the only party that's capable of reforming the NHS to make it fit for the future. When I look at other countries and why they're doing so much better than us, it's because we spend huge amounts on our hospital care, but when it comes to primary care, so things like getting a GP, mental health, community services, diagnostics, which I've mentioned, we're either near the bottom, at the bottom, or seriously lagging behind. And so what we're setting out is a 10-year plan, not just for investment, but for reform, to make sure that we have more care available to people closer to home, a neighbourhood health service as much as a national health service, which means we can diagnose earlier, treat faster and better for patients, more effective use of taxpayers' money. And we're also going to shift the focus to preventing ill health as well. We've got a growing ageing society. We've got rising chronic disease and things like diabetes, cardiovascular disease, which are entirely preventable. So we've got to have the right public health measures in place too. So we've got a serious plan to do that. It's a serious plan for investment and reform. And people can judge us on our record. When we were last in government, we delivered the shortest waiting times and the highest patient satisfaction in history. We did it before. With your support, we can do it again.
Just got to clarify, be careful when you're talking about diabetes that you're talking about type 2 and type 1 on that, otherwise you'll upset those type 1s of us out there.
Yeah, I'm glad you mentioned that, Stephen. You're absolutely right.
Yeah.
Wes Streeting, just before we let you go, I wanted to ask your response to the YouGov poll last night that placed reform ahead of the Conservatives. You heard Nigel Farage saying last night that Reform UK is now the opposition to Labour in this country.
In that clip you showed, I thought, well, for once I agree with Nigel Farage. Why on earth would you trust a party and its promises when they've had those promises in 4 manifestos now and broken them every time? Look, look, with Nigel Farage, I'd just say 2 things about Nigel Farage and reform. Firstly, this is another chapter in the Conservative Party's psychodrama. We've got Conservative candidates like Andrea Jenkins that have got Nigel on her leaflets rather than her own leader. And I just think if the Tories get back in, this is the next chapter of that story, the chaos, the division. Do they merge with reform? Is Nigel their next leader or not? And look, I think that's chaos that we don't need anywhere near government. And the second thing I'd say is on Nigel Farage, I don't underestimate him as a campaigner. We have sometimes learned to our cost, being on the losing side to Nigel Farage. He's a formidable campaigner. But what Nigel Farage has never been tested on is actually delivering the change he says he wants to bring about. So we're going to take him on the arguments. We're going to take him on the issues. I think it's appalling, actually, the way in which he's had things pelted at him during this election campaign. He's got every right to be heard. And we're going to take him on the arguments. And if he's elected to Parliament, and that's a big if, he's not been so far, we'll take him on in the Commons chamber. But otherwise, whether it's in Clacton or across the rest of the country, people have got good Labour candidates who, if we get elected, can deliver the change, the practical, real change our country is crying out for.
OK. Shadow Health and Social Care Secretary Wes Streeting, thank you very much indeed.